And we'll go ahead and dive right in. I'm Christy Ariano from the Colorado Health Institute, joined by my colleagues, Lindsay and Adiran. I will give a little bit more detailed introductions on us later, but I want to thank you to everybody who's joining today. And let's get started. Before we dive in, I just wanted to provide a quick overview of our time together today. I also want to note that we are on a regular Zoom call rather than a webinar. So if you haven't already, I'm going to ask you to please mute your microphone. We will open it up for discussion, excuse me, a little bit later during the program. We'll have both an opportunity for questions and some possible breakout room discussions. So we will invite you to turn your mics on and chime in at that time. And if you have a question at any time throughout the presentation, please make use of the chat function. We will be monitoring that and we will be able to answer questions as they come up. I'll also note that we are recording this session, so we will make it available if you want anything repeated, or if you want to share this information with your peers and colleagues, we will share the link and make that available. You'll see a general overview of the topics we'll be discussing on your screen right now. And there's a lot we want to cover, so let's just dive right in. Again, we will be monitoring the chat, so if you have questions, just jump in at any time. Our plan is to do a high-level overview of the project. Then my colleague will talk a little bit about the metrics and methodology, how we arrived at it. We'll walk you through the tool and then talk a little bit about how you can use it to support your work and any questions you might have. I hope that most of you are familiar with the Colorado Health Institute. If you're not, we are a nonprofit, nonpartisan provider of independent data and evidence-based analysis to support decision makers who are working to advance health policy in Colorado. We work with people and organizations at all levels, from community organizations and advocacy groups to large health systems. The common tie between all of these is they are people and organizations who are working to improve health for all Coloradans. As Colorado's health policy landscape has changed, CHI has grown to meet that challenge. In addition to providing public-facing portfolio of work that is funded by philanthropic funders, we do consult with individual clients to provide not just analysis and data, but strategic planning, facilitation, complex modeling, evaluation, and strategic communication support. The Root Causes project we're here to discuss today is funded by one of our generous philanthropic partners, and we'll talk about that shortly. But if you or your organization has a vision or a need for the services we provide, I'd encourage you to get in touch. A little bit about myself. My name is Christy Ariano. I am a managing director here at CHI, and I've been involved in the Root Causes project since the outset, and my role has really been to ensure that it is as usable and friendly as possible. I'm joined today by my colleague, Lindsay Whittington. Lindsay is a research analyst here at CHI, and she has really been the data guru on this project. So when we get into the methodology, she will be walking you through that. And our colleague, Adiran Okoloko, she is a program manager here at CHI, and she's really engaged in ensuring that it's available to community members and that we have sessions like this to really onboard you and make sure it's accessible to everybody. She also generally just keeps the trains running on time. Now it's your turn. We'd like to hear a little bit more about who's joining us today. We are going to pop a poll up on the screen, hoping you can fill that out and tell us what sort of organization you're here representing today. Take a few more minutes to get everybody's answers. And Adiran, is that poll closed or are we taking a few more minutes?
It's taking a couple more minutes. We're just missing a few people.
Okay, great. All right, so it looks like we've got a good split and some good representation today. Good portion of you from government agencies and healthcare providers, a couple from community and advocacy groups, and payers and foundations. So thank you all for joining us today. I really like seeing that cross section, knowing so many people are interested in this project. We're also interested in hearing how you are hoping to use the data from the Root Causes Project. If you want to dive into that chat box and share maybe the type of information you are interested in, or if there are specific components of the project that you want to be sure we cover today. I would also invite you to chime in with if you have already used the Root Causes Project or if there are specific ways you're hoping to use it. All right, we've got a quiet group this morning, so I'm just gonna move us right along. All right, so what is root causes? It's great to see such a broad group of folks here today. I want to start by saying that the Root Causes Project was supported by the Colorado Health Foundation. They really saw the need for data of this nature out in the community. So we want to thank the Colorado Health Foundation for partnering with us and helping us bring this project to reality. Root causes came about because when we engaged in the community, we often heard from people who said, we know we have a problem, we just don't know the solution. Whether they were an organization who was dealing with teen suicide, substance use disorder, they said they knew that there was a problem, they just didn't know what specific levers they could target in order to improve outcomes in their communities, which led us to ask, is it possible to map the data on social factors while exploring the specific influence that each social factor has on mental health outcomes? And if we can show how much influence each of these factors has on mental health, can that then provide some guidance in terms of influencing policy and allowing organizations to see which neighborhoods they can possibly target for the most impact or which policies they might be able to? And that was the genesis for the Root Causes Project. For all of its online bells and whistles, essentially this project is guided by 3 research questions. How can we best address behavioral health in our communities? Where are the needs the highest? And what social factors are associated with these needs? We've rolled out the project in 3 phases so far. The first phase, which we call the Snapshot of Colorado, launched in the spring of last year. And that was primarily an interactive census tract level mapping project that showed not only the individual social factors data at the neighborhood level, but also dashboards that really showed how each of these social factors then influenced mental health outcomes. Second phase launched in the fall, and that really looked at changes over time. So it allowed you to go in and look at the last 10 years to see where areas saw the biggest changes. And rather than just tracking the changes, we also looked at where some of those changes were the biggest and talked to community members about what those changes meant in their communities, how it impacted mental health, and how they've responded. So that's a very story-driven piece of the project. And the newest portion, which we rolled out late last year and are beginning to launch a little more aggressively now, is the really exciting part where we're looking at the actual relative contributions to see how improving these different social factors, how much we can influence behavioral health in communities. So when we go to the website, you'll see that phase 3 is primarily the most visible piece of the website right now. It's the piece that we think is the newest and has probably the most innovative research. But all of that data down to the census tract level and the dashboards are all still there, and Lindsay will walk you through that shortly. And now I'm actually going to hand it over to Lindsay. She's going to talk a little bit about the methodology and how we arrived here, and then she'll walk you through the project.
Thanks, Christy. So again, my name is Lindsay Whittington. I'm a research analyst at CHI, and I was really involved in the development of all the mapping applications, as well as a lot of the analysis in this project. So after we went over an overview of the 3 different phases, I will now provide an additional context around the different methodological parts that built this project, as well as the metrics that are available on our website. So each phase of the Root Causes project builds upon this idea that data should be easily accessible and widely available to researchers, policymakers, and other stakeholders to help them inform on issues in their communities. The first phase of this project created what I really like to call a one-stop shop for data and information across all different local areas in Colorado. So the first phase brought together data from many different public-facing sources of data. I have listed some of them here in this matrix for you all. Some examples that I wanted to highlight were demographic, employment, and other income data from the American Community Survey, which is from the US Census Bureau, insurance and housing instability data from the Colorado Health Access Survey, mortality rate data from CDPHE's Vital Statistics, and substance availability data from site licenses from the Colorado Department of Regulatory Agencies, or DORA. So these are just a small fraction of the indicators that are available through the Root Causes first phase of work. So actually there's over about 60 social, economic, and health related factors that are available in the interactive mapping application. We used all of these data to build this interactive interface and other dashboards at the state and local level to really show and highlight the relationship between mental health and these specific factors that impact people's lives in Colorado. So this really brought together research and the supportive data all into one place for everybody to use. So additional information on all the other indicators that are involved in the Root Causes project can be found in our methodological pages on the variable description page. So that's phase 1. Phase 2 really brought together a local perspective. So phase 2 of the Root Causes project really identified how things change over time in these local areas. While phase 1 provided a snapshot in time, phase 2 added 10 years of data to help trend over time to help users understand just how quickly things can change and how these changes might impact a person's mental health. In addition to adding time as an element to all the interactive maps, CHI also wanted to bring the local voices to the table. So through engagement and outreach efforts, CHI was able to conduct interviews with local experts and Coloradans to help frame the data with a human perspective. Each of these local stories is housed within the interactive map and helps paint a picture of how different areas in Colorado have been impacted by certain factors and what these different factors mean for mental health in those areas. So I've provided some of the highlights from these local stories. So we explored insurance rates in the San Luis Valley, income inequality in East Aurora, and unemployment in Southeast Washington County, among other areas. So we further explored how these factors impacted mental health in these specific communities. So part 3 was some of the really cool innovative work that we did on the Root Causes project. So in this final phase of work, we actually developed a model that quantifies the contribution to the improvement in mental health distress in Colorado. So this analysis was adapted from the Tingle Threats model, which was outlined by Milstein and Homer. And we actually were able to work side by side with these lead authors of that project to help develop a model specific to Colorado. So as was seen in the Tingle Threats analysis, a series of stepwise multivariate linear regressions were performed across all counties in Colorado, and variables were eliminated from the model when significance was not met. So this analysis actually identified the social, economic, and health-related factors that both directly and indirectly impact mental health in our state. The main outcome of interest that we used for this specific part of the project was the percentage of Coloradans who reported mental health distress. So Christy, thank you. So the unit of analysis for this project, for this part of the project, were the Colorado's counties, so 64 different counties. Because of this, the analysis controls for key demographic factors like race, ethnicity, age, rurality, and focuses instead on the modifiable factors when examining the relative contributions to mental health distress. So this model was created on the website on different interactive platforms that help describe the contribution to the improvement of each one of these factors on the mental health distress through a visualized causal chain. So that'll be a part of the online tour that I show you. So now, after I explained all the different 3 phases, let's jump in to actually so I can show you each one of these phases on our website. So let me, all right. All right, Christy, are we seeing the root causes page? Okay, thank you. All right. So the root causes project has really been designed to allow users to browse and dive deeper into many different metrics that describe Coloradans at a very localized level and their relationship to mental health. So our landing page outlines these different tools in an easy to use button fashion. So kind of like what Christy said, because phase 3 is our most recent work, it is highlighted upon the main landing page, but we also have the phase 1 and phase 2 work stored in here as well. So over here on the right-hand side of the page, we can see these different buttons, and this actually links us to the phase 1 and phase 2 work. So I'll start us by beginning through the mapping application, which we developed in phase 1, and then we further expanded in phase 2. So you can find the main mapping application in the Explore Root Causes section by clicking on this link below. So this link will take you to the main mapping application. So this interactive map brings together all of the social, economic, and other health-related factors that I mentioned during the presentation slide. And this really brings together this idea that all of these different factors influences a person's health, their way of living, and also their mental health. So these data metrics are designed to get a really local view of our communities in Colorado and its impact across the different years from 2009 to 2019. So as you can see on the left-hand side of the page through the different, the accordion view here, we can see all these different topic areas, and each one of these topic areas has a plethora of different metric housed within each one of these tabs. So for this example, I've already got the Education and Employment tab open. So let's dive deeper into one of these specific maps so that we can see how these work. So to view a specific metric of interest, all you have to do is click on the little square next to the metric that you would like to look at. So let's go ahead and look at employment rate in Colorado. So once you've selected your data of interest, you can further dive into this metric across the state in these local areas. So you can actually view data across time in a couple different ways on this specific mapping application. You can use the time slider widget, which you can find here at the bottom of the screen. And this helps you actually visualize the different metrics across time. So to view the legend so we can get a better perspective on what these colors mean, you just have to click the little arrow next to the metric of interest. So this will drop down our legend. So then when we use the time widget, we can actually toggle through each one of the years that we have data available for, and you can see it visually change over time. So this application actually also houses exact values for each one of the geographic regions in the census tracts in Colorado. So I want to show you guys a little bit deeper dive into this. So let's investigate a specific area in Colorado by using the search at the very top. So I'll look at Denver. So this zooms in to your geography of interest when you use the search widget. So by clicking on the different census tracts or neighborhoods in this area, you can actually get these metrics at a very local level with the exact values as they have changed over time. So for this example, when I click on this neighborhood, it pops up the little pop-up, and we can get exact values and how they have changed between 2009 and 2019 for the Green Valley Ranch neighborhood. So this interactive tool pairs together the interactive maps as well with interactive dashboards for several topics of interest that we wanted to highlight for everybody. So you can find these additional dashboards using the main menu screen at the top of the screen here, which lists out the different topic dashboards that we have developed in tandem with the main mapping application. So for this example, let's look at the income dashboard. So once you click on the income, it'll open up this separate dashboard. So it houses the income level main mapping application that is housed in the main one, so that you can focus on these metrics of interest specific to income. So along with the topic map at the top of the page, we can also find all sorts of additional information which is provided here by the dashboard in figures and tables, which helps further describe the relationship between income and mental health in the state of Colorado. So these dashboards provide a story to the data, which focuses on the importance and influence of each of these factors and why they are important or related to understanding an individual's mental health. So you can also download each one of these dashboards in a PDF version, in a printer-friendly one, by just scrolling all the way down and hitting the download button so that you can use this for yourself. And it has all these different figures on it. So root causes further explores each of these metrics at the county level. So in addition to the state level dashboards, we also created county level dashboards with additional downloadable content. So you can find these dashboards for your county by clicking on the counties button on the main menu at the top of your screen. So once you click on that, it'll open all the different dashboards available for all 64 counties. So for this example, let's look at Pitkin County's dashboard. So here we see a more local view of mental health in Pitkin County. The county level dashboards provide the same data, similar with different figures as they relate to mental health and specific indicators in that county of interest. So here we can see mental health as it pertains to insurance status, as well as housing instability in Pitkin County. So these are also downloadable by just scrolling to the bottom. You can also get your county of interest and download that PDF so that you can use those. So another item that the root causes highlights is local stories in Colorado. Let me go back to the main menu. So the mapping application provides these stories in the very first tab, local stories. So when we click on this, it brings up where we have housed our additional local stories tab from all of our outreach. So this mapping application stores these all in the different tabs. So stories that we have highlighted are insurance coverage, income inequality, unemployment, as well as housing costs. We conducted these key informant interviews with local experts to help shape the story behind mental health and each of these metrics in these specific communities. So you can find each of these stories by clicking on the links provided in the tabs. So for this example, I'm going to look at the insurance coverage link and its relationship to mental health in the San Luis Valley. So when you click on the link, it'll take you to the additional local stories dashboard. This story provides insight into changes in insured rates across the San Luis Valley and interviewed experts in this area to understand how these changes may have influence over a person's mental health. For example, we can see that since the expansion of Medicaid, there has been a large decline in the uninsured rate in this region. However, a local expert helps us understand this relationship between insurance coverage and the increased use of mental health care, that this relationship is very complex, especially in rural areas where healthcare resources are often too far away for many folks. So each one of these communities has its own dashboard, which is really cool. So you can see the different stories that we were able to get from local experts. So let's toggle back to the main landing page. So there has been a lot of innovation and creativity that has come out of the Root Causes project. So our phase 3 work, which is the one that's housed on the main landing page, I think really highlights this. Much of phase 1 and phase 2 really sought to understand and shape the story around all these different factors that impact a person's mental health. But phase 3 actually helps us quantify that relationship between mental health and factors that we outlined in phase 1 and 2 of our work for the Root Causes Project. So as I mentioned before, phase 3 of this project quantifies the relative contributions of various social factors to mental health distress in Colorado. In this phase of work, the model used county level data for all 64 counties. The percentage of Coloradans who reported mental health distress was the main outcome of interest. So the model actually helped us identify 7 factors that have direct impacts on mental health and a series of other indirect factors that work through all these other factors in what we call the causal chain. So the 7 factors that best predicted mental health distress in our models were income disparity, poverty, unemployment, uninsurance, food access, physical inactivity, and insufficient sleep. All the other factors that are included on this diagram worked indirectly through these 7 proximal factors to impact mental health distress in Colorado. So ultimately, there were 23 factors that were found to be significant at one stage or another along this causal chain. Some factors work through multiple branches, such as food access, which you can see here impacts not just mental health, but also works through insufficient sleep, as well as juvenile arrest rate. So of these 23 factors, 18 were potentially modifiable, where we held the other 5 demographic factors constant. So this analysis controls for those demographic factors, but highlights those 18 modifiable factors when examining the relative contribution to mental health distress. So by setting all 7 of these proximal factors to the best feasible value in Colorado, the regression analysis actually shows us that Colorado could achieve a 19.8% in mental health improvement by working through all these direct factors, which is really, really something. It is important to note that along this causal chain, each modifiable factor's contribution to the improvement of mental health distress is only if that one factor is moved from its starting value to the best feasible value in Colorado. So for example, college attendance rate, by clicking on the button, if we were to increase the college attendance rate to its best feasible value, we would see a 3.4% improvement in the mental health distress rate. So the contributions of these factors are not necessarily additive, so you cannot add these all together to get a combined total relative contribution. But instead, one factor may have an impact on others that overlap along the causal chain, which we can see through all these intricate relationships that all these factors have together. So in addition to this state level dashboard, we also created regional analyses with different models to really highlight these changes in different parts of Colorado. So counties were organized into 5 different regions in the state: the Denver metro region, the Mountain Resorts and Northwest region, the Northeast and Eastern Plains region, the Southeast region, and the Southwest and San Luis Valley region. So for this example, let's look at the contributions of improvement for these factors of interest on mental health distress in the Southeast region of the state. So this area includes counties such as Bent, Prowers, Otero, and Kiowa counties, among others. So we can see that we get the exact same causal pathway, but this is catered specifically to the Southeast region of Colorado. So for example, by looking at the unemployment rate in this region, if we were to increase the unemployment rate to its best feasible value, we would see a 3% improvement in the mental health distress in this region. As well as if we scroll down and look at insufficient sleep, we see almost a 4% increase in the improvement of mental health distress in this area. So by setting all 7 of the proximal factors to their best feasible value, we can see that we can achieve a 22.3% improvement in mental health distress in the Southeast region of Colorado. So based on your region of interest, you can find these different contributions of improvement for the factors included in the model in each of these interactive dashboards. So these are also downloadable. Just by scrolling to the bottom, you can download this PDF so you have it at your disposal. All right, and let's toggle back to the main homepage. So root causes brings together many, many elements, and it brings together the mapping application and interactive dashboards, which brings data and local stories together, helping frame the data that relates it back to people who are impacted by these factors. By utilizing these tools, data and research can come together to help inform on integral policies and programs that can help make meaningful change for people impacted by behavioral health issues due to the network of factors that influences a person's life. All right, so that finishes up the TA portion of the webinar. I'm going to turn it back over to Adiran to continue the rest of the webinar.
Okay, thank you, Lindsay, for that walkthrough. So now we want to hear directly from you all, and we'll do so in a moment using breakout rooms. But before we break into smaller groups, we want to stay together for just a few minutes more. Since we just dove deep into the tool, we'd like to hear any feedback you have about the utility of the tool and whether you have any questions. We're happy to answer any more focused questions about how it works, as well as where to find information and what kinds of data are available. You can feel free to put your questions into the chat and we will read and address them from there. Or if you are comfortable and able, you can use the raise hand feature and I can call on you when I see your virtual hand raised so that you can share your question out loud. To use this feature, click the participants button at the bottom of your screen and then click raise hand in the panel that will appear on the right. Your name should have a little blue icon with a white hand appear next to it if you use that feature. Do we have any questions, either through the chat or that you're willing to share verbally by using the raise hand feature? I saw a couple come through to the chat already. And if there aren't any questions at this time, we can certainly capture any during our breakout rooms as well. Great. A question from Nancy: how can we access this tool? Oh, a lot of questions coming in now. Okay, so how can you access this tool? So you should have received actually a link with the reminder email you got for this training yesterday that has the link that shows you that main landing page that Lindsay just toggled back and forth from. I will also make sure that we include that link in any follow-up communication you receive from this training. So thank you for that, Nancy. Clara, is there an analysis around accessibility to services or providers available in the areas?
Yeah, I can grab that one. So one of the factors that is actually in the model is the number of providers per 1,000 residents within a different sense in the counties. So we do have that as kind of an accessibility piece. We also did mental health facilities as well as ER facilities in different areas, but those were not found to be significant in the model. So we did test those, but they fell out of the model when looking for these different factors and testing for significance.
Thank you, Lindsay. And then Nancy is also wondering if they will have access to the slides to guide them through the tool.
We will send out the slides after the event, as well as a link to the full video in case you want to review anything we've talked about, and we will send the slides and the links.
Great, thank you, Christy. Any other questions at this time?
I do want to call attention to a couple of questions that rolled by earlier. Most folks may have seen them, but somebody did ask about when the data will be updated. Because it comes from so many sources, everything is on a slightly different timeline. For example, the Colorado Health Access Survey data, that survey is in the field right now, so that data won't be available for additional updates until probably late this year, early next year. And then of course, things like census data, ACS, tend to come in on a slower timeline as well.
Great. And I'm not seeing any hands raised at this time, so we might be able to move forward. All right, so now we get to the heart of the matter. What does this all mean for you, and what can you do with the data? So we created root causes as a public utility, and we want to ensure that it is available and accessible to as many people as possible. We want to make sure that people know about the tool and how they can use it. So initially, some of the ways we thought organizations could use it are for determining how or where to focus grant making or community engagement work. So for example, an organization can use phase 3 to look at the levers where funding might most impact mental health. Similarly, as nonprofits and community organizations are writing grant applications, we hope that the information on both the levers and the current social factors in individual neighborhoods and regions can provide a statistical lens to help illustrate the need for your project or effort. The dashboards that Lindsay just showed can be used to set the current state for various counties and regions, and they can also be used to open community discussions and events, or to familiarize people with communities or spark discussions within those communities. The data can also be used to support your advocacy work by providing a statistical backing for the policies you are promoting. And the mapping application can be used for developing research questions and providing important data points to craft and support them. Beyond the numbers, these tools also share local perspectives and shows you where you might look when you are seeking local stories. So we have also heard from organizations that are using the dashboards that can be used to set the current state for various counties and regions, and also be used for various different discussions. And these are just a few suggestions that we have, but we want to dive deeper and get your perspective on how you might use it and what other needs you might have from the data. So now we are going to be breaking out into groups. In just a moment, you should see the breakout room option to join pop up on your screen. And we want to dive deeper and get your perspective on what you're going to use from this data. So a few questions to think about while you're in your breakout rooms. 1, are there specific ways root causes can be used in your work? 2, are there examples of ways you have already used root causes in your work? And 3, are there additional tools or features that would make root causes even more useful? So I am going to open the rooms right now. You all should see that pop up on your screen, and you can go ahead and join those so you can discuss this together in a smaller forum. We're getting everyone joined back to the main room now. So great, why don't we just do a quick share out to hear what everyone is thinking about in terms of using this tool. I can go first. We talked a lot about potentially using this to help guide community needs assessments, grant applications, talked about how it's very useful because it's difficult at times to plug and find the individual pieces of these data, and then having it all in one place really opens up the possibilities for the ways that you can use it. And then we also talked a bit about other organizations and partners that would be interested in the data. I shared, of course, that we do have that's training coming up in March, but that we can also reach out. There was a question that came up that I wanted to share. We were wondering if there's a way to find out each individual data source, and at what points do you get to see that? Lindsay, can you?
Yeah, we have, so that was something that came up in our group as well. So we have on our methodology page, we have the methodology for phase 3, but we also provide a big list of every single data point that is provided on the map and where you can find that information. So there's links in there as well as overall descriptions and summaries of each one of those data points, which is on the main page. There's a big link in the middle that links to the methodology that's on that main page.
And hopefully that is easy to find, but of course, if you dive into the site and things aren't where you're expecting them to be, just email Lindsay or Adiran or myself, and we can always walk you back through that.
Perfect. Christy, do you have additional things to share out from your group?
Yeah, we talked about a couple of things. One of them was how this work can be tied to social health information exchange in terms of what people should be screened for. And we also looked at sort of the social influencers of health in terms of, can this information maybe support organizations making an argument for food aid or similar types of propane, for example? Can the argument be made with this data that this information, that funding these things will have an outcome on behavioral health? Anything else my group would add?
I think that sounded good.
Perfect. And then Lindsay, anything additional to add?
Yeah, I think our group, it echoed a lot of the stuff about, this is a huge landing site for so much data. So it's kind of like, so what do we do with that next? So we have all this information, and how do we kind of frame those research questions? And I highlighted that perhaps starting with the dashboards and some of those more focused descriptions can help kind of frame those research questions. But one of our group members was also a provider. So it's kind of understanding the difference between utility, I think, between public health, providers, payers, that usability could look a little bit different based on who's using them.
Great, thank you. All righty. So again, as I said before, this tool really is a public utility, and we want to make sure that it is serving the needs of as many people as possible. We recognize that the tool is incredibly robust, and it is so by design, because we wanted to make sure that we included as much information and data as possible. But we can also recognize that at times that can be a little overwhelming or confusing. And so we welcome you and encourage you to reach out to us. We're always available for information requests, or if you have questions or want more detail on something, feel free to reach out to us by either giving us a call or sending an email. Now, Lindsay's email is there on the screen. So she is a great contact for this information, being the data guru behind all of this. So if you have any interest in indicators or additional data, definitely reach out. Also, again, want to share that we do have an opportunity for an additional training in March, and that'll be March 11th. So if you want to join the training again, you can certainly do that, or certainly pass it along to any of your colleagues or partners that might want to do that as well. We'll be sending a follow-up email with the link to this presentation, as well as the recording to this. So you can share that with others who might find it useful, or reference that for yourself moving forward. And then, like I said, that March 11th training is going to be scheduled soon, and we'll share a registration link for that as well. Also, in an effort to expand the research of this project as much as possible, we will be launching a Spanish version of the tool within the next few weeks as well.
And our hope is that once that Spanish language version does go live, I think you saw a sneak preview of it on a couple of the graphics when Lindsay was walking us through it. But if there is interest, we are also exploring doing a Spanish language version of this training.
Yes, thank you, Christy. All right. So other ways that we can support your work, CHI focuses on data-driven approaches and provides a whole suite of analytical services for people looking for data on the state or in their communities. The Colorado Health Access Survey, developed by CHI, can help answer questions about a wide range of health and access issues in Colorado. Our data experts are available to help provide data support for you to answer research questions in your work. And we're also constantly producing new research briefs and reports and analyses. I wanted to call your attention to a few of those pieces, all of which are available on our website. We included as links in the follow-up email as well. You can see a number of those projects up on your screen right now. Some recent reports, one around school-based health centers and a needs assessment that has been pretty useful and gotten really great feedback, as well as a new analysis on Colorado suicide data, and then also COVID-19 data reporting and policy analysis. And then also, for those of you who may not be aware, CHI provides a suite of consulting services, including evaluations and assessments, strategic planning, focus groups, etc. And so if you want to learn more about that, please reach out to us as well. If there aren't any other questions, we can go ahead and close out. I want to thank you all for joining us today and taking part of your day to learn more about this tool. And then, as we said before, please don't hesitate to reach out to us if you have questions, or as you dig into the data itself, if things come up. We are certainly here to make ourselves available.
One final thing I'll add, I know there's a lot of interest in having these links and the recording. We will follow up just as soon as we can with that email, but it may not be immediate because it often takes a little while to download the full recording and get it posted. So it may be a day or two before all of those resources are available.
Thank you all. This was really helpful.
Thank you. We really
Great work.
appreciate you joining us, and do share that we'll be doing this again next month if others are interested.
Thank you.
All right. Thank you.
Thanks, everyone.
Bye.